Good morning and welcome to the webinar. My name is Sudha Thambuswamy and I'm a broker advisor at Cornerstone. Today I'm joined by Arnold Saunders, who's going to discuss Anthem Indiana fourth quarter. But first, we have a little bit of housekeeping. If you have any questions throughout the presentation, please type them in the question box and we will address them during the Q&A at the end. My information is on the screen if you'd like to get in contact with me. And don't forget to follow us on social media and subscribe to our weekly Monday Minute newsletter. We keep you in the know with any industry and Cornerstone updates and information. Contact your Cornerstone broker advisor if you are not currently subscribed. From downloadable social media images to customizable flyers, Cornerstone's Marketing Hub has what you need to start managing your marketing in-house. You can access the Marketing Hub through the Cornerstone Resource Center with your username and password. Contact Jess Larkin at jlarkin@cornerstone.com with any questions. Take advantage of Cornerstone's exclusive partnership with EB3 to put together your customized benefit booklets. This automated technology is specifically designed with employee benefits brokers in mind, with low monthly pricing, customizable color schemes, the ability to add your own PDF documents, wrap documents, FPDs, and so on. Contact your Cornerstone representative for more information. Now, I'd like to introduce Arnold Saunders from Anthem Indiana, who's going to walk through the fourth quarter updates.
Thank you, Sudha. And good morning, everybody. Good morning, and thank you all for joining. Thank you, Cornerstone, for allowing me to actually present to all these professionals in the field out there as agents and brokers. We certainly appreciate it here in Anthem, at Anthem in Indiana. What I am going to be discussing today is the 2023 strategy that Anthem Indiana has for our market over here in this state. We have quarterly broker meetings, almost like semi-annual meetings now, and then we have one virtual now. And this last fall broker roadshow is one that will impact you going into this fourth quarter peak season and also 2023. So I want to give some highlights of what Anthem is offering for this period, this fourth quarter of 2022 and through the year of 2023. I've got some exciting stuff coming in 2023, some new changes coming into our plan. So let's get right into that. If you don't know anyone at Anthem, this is the Anthem team in Indiana. Over here is the manager of small group team. This is Joe Gilbert. You can see my circling there. And this is me right here. So I'm your representative for brokers who are in Ohio that have Indiana business. I'm your representative, and I also have South Central and Southern portions of Indiana as well. So any brokers that are located there also have me as a representative as well. So essentially, I'm just going to hit some highlights of some of that presentation. We had a large group that presented in Medicare and all other departments that got up there and talked. I'm just going to go over some things that will impact you all in the field as individual and small group representatives. So that's our focus today. Anthem is constantly reimagining what's possible for health of our members and being more involved in the community and looking to get down to the nuts and bolts level of who we actually serve, which are our members. And so we're always looking to have meaningful connections and impact on their lives. And so nothing's changing there, but it's always changing at the same time. It's always been our position to do that, but how we do it always changes. And I'm going to skip past this part here and get to Some details here of how many members we have in Indiana. More than 3.5 million members in Indiana, 43 million Anthem members nationally. 1 in 3 people in the country are Blue Card members. So Anthem, in 14 states, we've got a vast, broad reach. You guys are probably already aware of that reach because you have Anthem in Ohio, Kentucky, and wherever else you may be from. We were also chosen as one of the best insurers for small businesses. And one of the main things that we're doing right now, one of the main focuses we have is that Sydney app, and using artificial intelligence in the Sydney app to have engagement with our customers wherever they may be, because this is an app you would put on your mobile phone, on your mobile device, phone or a tablet, wherever it may be. And there's been a lot of focus on this. And why it's neat is because this, each customer, each member, we're putting at the center of the strategy for the artificial intelligence that we're using. We aren't saying, okay, we have artificial intelligence, now how does the member fit in? We're saying each member has unique needs. How can we make the Sydney experience wrap around them for a fulfilling experience? And so as the members use the Sydney app, it customizes itself to the needs of those members. So how they use the Sydney app will impact and change what the app displays when the member goes on that app and uses that app. So if they're clicking through and using the app more often for pharmacy claims, for example, then that should show up when they first log on as, like a reference to the pharmacy claims, or if they're using it for incentives, or if they're using it for provider finder, whatever, that app will customize for the member's usage. And so the people in a particular given family, each one of them will probably have a different home page or initial page when they log onto Sydney. So it's customizing as it's being used. And that's part of what Anthem is doing with this digital platform that we have. How can we make it fit the customer versus having the customer fit it? And so that's the effort we're going down, because we want to be involved in the members' lives in a meaningful way. And it's an award-winning app. So if you're not familiar with the Sydney app and you need more information on that, we can get that over to you. I have some flyers. But there's also that broker hub that you can use. And the broker hub has information for the things that you'll need in the field. Marketing materials and whatnot are out there on the broker hub. So if you're not familiar with that either, let me know, or contact Sudha and we can get that information over to you to know about broker hub, using that link to get to broker hub, or for Sydney app. If you don't have anything on the Sydney app, it's on broker hub, but I can also send you a flyer myself directly via email, because we need to be talking about that Sydney app in our employee meetings. We need to make sure that the members know that they have that app. Now, also there's Anthem.com. So Anthem.com, each member has their own portal, their own site that they can go to and use for all the things you can do on Sydney. It won't be customizing itself to how you use it, but everything is there. And so there's also that as well. So if you're only using a desktop computer, you can have a contact with Anthem as well on that, as always. Okay, so for our individual update, let's see. So 2014, we had the big 2013, 2014, we had the Affordable Care Act come in to play, and we've got individual coverage for everybody. Anthem jumped in, United Healthcare jumped in, everybody jumped in. Anthem came out with an HMO that was more limited in scope and the network. Other carriers had to saying, everybody's in the network, come one, come all. And the numbers were huge. Everybody did what they were supposed to do, or most people did, got in the network. And then the carriers all had to reassess and say, okay, so look at these claims, look at these loss ratios. Where are we going to going forward with this? And so Anthem got back out of the individual market for a time. But as of open enrollment last year, with 2022 effective dates, Anthem returned to the individual market. And we are still in the individual market this year as well. So we have some updates for you on the individual market, and just to make you aware of the offerings we have in that individual market. So we're staying in once again this year, not backing back out. But there are some things to kind of highlight here. The public health emergency, where we had people to come onto Medicaid due to what was going on in our country. There's more people coming onto the Medicaid market. They're going to be coming off of those Medicaid plans, and so we're seeing that as an opportunity to get people onto individual plans in 2022, 2023. So look forward to there being growth in those individual markets, and also a small group market as well, because of that change coming on to the individual market there. Extended subsidies or enhanced subsidies going on through 2025 will also be of interest to those who are on these individual ACA plans, as always. The family glitch rule is actually being addressed here, where individuals who have family coverage will be able to actually still get a subsidy for being on an individual plan versus being knocked out of that individual plan because their employer offers family coverage that costs less. I think is what that was. But that's being addressed, and as a result of the new rule, people will have more affordable coverage now to be able to actually get that coverage that they need and not being blocked from it, and we'll be able to have the coverage that they actually need for 2023. So that's a good thing as well. So we relaunched the individual product in 2022, as I said earlier. We'll continue to keep the plans we have in place. The bronze, silver, and gold plans will still be available to the members. And we're actually adding bronze, silver, and gold plans in regions 2 and 17, which is the South Bend and Evansville areas, for those of you who have dealings in those areas. And this is what the ACA network looks like. So we have 2 individual plans to actually address the Indiana market. One is the ACA plan that's on exchange, and then there's the AEC, the Anthem Enhanced Choice individual plan. First up here, we have the ACA on exchange plan. And we have in the blue there, the network reach for Indiana University Health Market, which is our largest hospital network in Indiana. So IU Health is the dark blue color there in mainly the central part of the state. Those IU Health Network providers are in the ACA network, and basically that's really the main driver of our individual network is IU hospitals. But over on the Terre Haute side, on the Illinois border, we have Union Hospital. It's also been added. We have Beacon hospitals that are a new addition to the northwest part of the state. And then down in the southwest part of the state, in that corner down there, we have Deaconess. So not all parts of the state are in the network. It is an HMO network. And so this is what our network reach looks like in Indiana for the ACA market. But the main driver, as I said, is IU network. If you know that the client that you have goes to IU already, then they are able to actually use, they probably will easily be able to use the ACA product we have for individual. The rate filings for individual for Anthem this year for on and off exchange is 0.5% for the increase that was filed for the 2023 plans. As you can see, their CareSource is up 9.5%, but it's worth noting that CareSource was so far below the other carriers in the individual market in Indiana that pretty much levels the playing field, and it does put CareSource at a disadvantage. So there's that. I don't know what they're going to look like year after year after year, just they've been low for so long. But the good news from Anthem's perspective is our rate adjustment was not a whole lot higher than where we were in year one. So we're going to still be competitive in the network, in the state rather. Got a new carrier coming in, Cigna's coming in into Indiana also. Not quite sure what that's going to all look like, how it's going to play out, of course, but they are entering into the market. CareSource, as of 2022, had 63% of the Indiana ACA market. As I said, you know, the rates were so low and they had so many providers in the network, it was like, you know, interesting to watch them keep their rates so low. And so now we see they're kind of right sizing a little bit, but you have to look at each individual case and see if it's going to be, you know, which carrier will be the best fit for Indiana. The individual ACA portfolio, we have the network is Pathway Essentials. And so we've got 15 HMO plans, 1 point of sale plan. We've also got the standard plans, which are 4 HMO, which is going to be off exchange, and 1 POS plan in that plan also. And then we have 1 catastrophic plan, which is a Pathway HMO plan. I think it's only in the, I forget what area that's actually in, but there's only 1 catastrophic plan, which is off exchange only. All right, so we have new Indiana plans. We have a Anthem Bronze plan that we're adding, which is an HSA plan. We're actually adding a new, new HSA plans to our individual portfolio this year or for 2023. And we've got 5 silver plans that are being added as well, and 2 of those are also HSA plans. We are have some updates here about the individual plans we're also adding. So all Pathway Essential plans, we're expanding into regions 2 and 17. We've got, let's see here, the Anthem Bronze Pathway Essentials plan, which has a copay for the first 3 visits of $0 for deductible and co-insurance. So, so for the first 3 visits to the doctor, rather, it will be a $0 copay. In 2022, move this out of the way, the copay was $30, and so now it will be $0 for 2023. And the RX Choice Tier 2 drugs, Level 2, increased cost share for Level 1 pharmacies. So those are your pharmacies that have the lowest copay and coinsurance, are the Level 1 pharmacies. For 2022, those plans were $10 or 10% more to go in, or $10 or $10 per copay or 10% for cost share for Level 1 pharmacies. For 2023, it'll be $15 and 15% cost share for those medications. So a $5 or 5% increase in Level 1 benefit structure. Select Tier 1 prescription drugs are offered at $0, so no change there. K-Health will continue with K-Health is where you would do chat with the provider. Here's the chat service you would have with the provider. There's no charge for that as well for 2023. Wellness incentives are going to remain the same, and self-service using the Sydney app is going to be no charge there as well, so no change there either. Commission for individual plans will be the $20 for the first year and $20 per renewal as well. So for 2023, there's no cap on the number of family members that you'll be paid commission on this year. So that's worth noting as well. mentioned the other plan that we have on the individual market is the Anthem Enhanced Choice, and that is this limited duration plan. So the ACA is on exchange and off exchange, HMO on the Pathway Essentials Network. Anthem Enhanced Choice is a limited duration plan that runs for 3 years in Indiana, not 1 year or 12 months like in Ohio. Ours is 36 months or 3 years in Indiana, and it's on the Pathway Network. It's a different network. IU Health Network is not in the Pathway Network. They are in the Pathway Essentials Network, which is an ACA on exchange. IU Health is not on the Pathway in the Pathway Network for this limited duration AEC plan. The AEC, Anthem Enhanced Choice Plan, is an underwritten plan. So maybe for your healthier professional clientele, they may want something that may give them opportunity to have a lower rate than a community rated plan. This would be your choice for that, the Anthem Enhanced Choice for those clients. We have 6 plans, and in the AEC network, we have some out-of-state hospitals as well. I think it's a Christ Hospital in Cincinnati and Cincy Children Hospital in the Pathway Network. And then in Louisville, we have Norton Healthcare Systems, and Norton Children's is also in the network, in that AEC Pathway Network. But so that's an option for you as well in Indiana, is a limited duration 36-month underwritten plan that runs, that's not just dependent on open enrollment, it's always available to be written. And that's the individual update. Now we move over into small group overview. For small group, in 2022, we exceeded our 2019, 2020, and 2021 sales results. Early on in 2022, we were at a faster pace. We hope that means that we're entering a new phase in this pandemic, where people are getting back to business, back out in the field, back in the market, and being active and more productive and staying safe. And the sales we have on our health insurance side is an indicator of that. So good news there. We've had a higher percentage of ACA sales in the small group department than we expected, which is interesting because we have that MIWA out in the market since 2019. It's doing good things, but that the ACA came in so strong, it surprised us a bit, but it's a welcome surprise. We'll take it for sure. Hopefully, it continues to be strong going forward. We have an increase in percentage of new business being submitted online. Anthem Indiana is really pushing towards submitting new groups, new cases, quotes, everything online versus paper apps being sent in and all that. So to those of you who have submitted them online, submitted new cases online, we appreciate that. Thank you very much. Anthem Indiana is #1 in the country on small group new business turnaround time. So when a new case comes in, we have people who are actually in the office here in Indiana who work on the cases, and their turnaround time is light years better than other states. Hopefully those of you who've submitted cases to us have realized that and recognized that as well. And we're very proud of that also. We have now over 1,400 MIWA groups and solid MIWA membership. The retention for the MIWA membership is really great as well. I think it's over 90%. So that's a good thing. We launched ADP PEO, which is still in its early stages, but that's available to members as well. We also have an HCC PEO arrangement that we also have that's available for those clients who look for PEO assistance in their business. Successful migration of target ACA groups to MIWA. So the groups that we can identify that are currently on ACA plans that will be good candidates for the MIWA. The successful migration to the MIWA from the ACA groups. Legacy groups are also being moved to ACA. Some of those groups have reached a point where they're better off in the community rated plan. Transition to the ACA from the legacy is also very smooth. A moderate rate increase on all books of business, which has helped us to be more competitive in the market. We have a soft launch of our new level funded Anthem Balanced Funding plan, which I'll hit on here in a little bit as well. So we didn't want to come out with a complete blitz saying, write this new level funded plan, it's great, match it up with all of your all savers and all this. You know, we know that we need to have our processes and our procedures in place to have it be a smooth and a pleasant experience, and not just sell, you know, that's a lower rate and whatnot and all that. We want to make sure we have the entire process smooth and great, and so therefore we're doing a soft launch of that product versus just going all out with it. So if when we get into the ABF section of this presentation, I'll go into more detail on that. But it offers as well for 2023. So here's a look at our small group portfolio strategy for Indiana. On the far right, we're looking at the ACA plans, which are, you know, your higher risk groups, more claims activity, for example. These plans are, of course, community rated, as you very well know. And as I said, it was a robust year this year for the ACA plans. But you know, this is kind of like that catch-all. And then you have the legacy plans that you can't write any new cases on, but we've had those cases in that same risk pool since 2013. And so no changes being made to new business, new blood being put into that risk pool. And yeah, it's remained competitive in 2022. It's been amazing how we've kept that up and kept that afloat. Now, at some point, you know, we all get older, so we're going to see demographic changes probably creep up, and aging have a stronger impact on the legacy. It's going to force the hand to get groups out of that pool at some point. But for now, and since 2013, it's been an interesting ride to keep those cases where they are in those plans. In the middle there, you see associations and PEOs. We have those are also underwritten plans and open for new sales. But in these cases, you have to join the organization that's running that series of plans. So you got to join either the chamber or the Indiana Public Employees Plan Association or the PEO, or wherever it must be. You've got to join some kind of organization to connect you to that. So that's a difference there. But we are active in that market as well. The MEWA is really the foundational plan for our preferred risk groups that are out there. So if you have a group that is healthier and they would benefit from being underwritten versus being community rated, the MEWA is the golden child for that. So I would say to definitely look at the MEWA for that, and then compare it to your ACA rates. That way you kind of have an idea, you know, what the best move or the best alternative is for your clients. You must also join the chambers for the MEWA as well. So either Indiana Chamber or Indy Chamber. Indy Chamber is for the groups that are domiciled in Marion County, which is Indianapolis. So if your group is in Marion County in Indianapolis, they must join the Indy Chamber. The surrounding donut counties that are all around Marion County, all around Indianapolis, those clients can choose either the Indy Chamber or Indiana Chamber, and everywhere else is Indiana Chamber. So that's the MEWA, and your organization, your client and your agency, or you as a writing agent, must be a member of the chamber, just so you know that. I think you all go through Cornerstone, so they'll take care of that for you. And then on the far left side here is the ABF, so the Anthem Balanced Funding Plan. This is our strategy for the level funded offerings that are out there in order to compete with those level funded plans. Now on this, we have to first quote the MEWA, and then you go into a negotiation to see if Anthem Balanced Funding is going to be better for you. Now, in general, what we're looking at here is MEWA probably would be better off for your younger, healthier groups, younger average age, healthier groups, and the ABF probably more for your older, healthy groups. This is new, so we don't quite know for sure, but the way it's kind of calibrated is showing us that's probably going to be your better option. And so I'll get more to the ABF later on, but just kind of give you an idea of what we're looking at here. The MEWA is still that first option. Then the ABF would be a little deeper negotiation to hopefully get to a rate that would keep the group or would win the group to Anthem ultimately. And the ABF is not for existing Anthem clients, by the way, either. It's only for new business or for new groups that don't currently have Anthem. Okay, so this is your HSA limits, the ACA maximum out of pocket limits for 2022 and 2023 there. Oh, hold on, I missed that. Back up here, so you can see that once again, in case you haven't seen this yet this year. For 2023, you're looking at $9,100, $18,200. Minimums for HDHPs, $3,000 and $6,000. That's the minimum. And the maximum out of pocket limits for HDHPs, $7,500 for individual, $15,000 for family. Okay, some updates here. Removing copays from Live Health Online. So Live Health Online is our virtual care service that we offer. So all copay-based plans, except for our legacy plans, will have a $0 copay for using the virtual care benefits on Live Health Online. I mentioned Sydney earlier. You can also tap into Live Health Online using Sydney, using your mobile app as well. But it's also livehealthonline.com. You can reach them there as well. Kidney transplants will now be integrated into our standard transplant benefits. They were formerly excluded. We're making all primary care physician office visits for kids under age 19, making all of them have a $0 copay under new and existing PPO plans that apply copay deductible coinsurance to high ticket items like inpatient hospitalizations and outpatient surgeries and emergency room. And those plans will have a focus suffix to their plan name. So you'll see the plan name, like the example it shows there, and then you'll see focus and the WH there. Focus with WH means whole health. You have specialty services that are also a part of your medical coverage. So certain small group ACA PPA plans, certain small group ACA PPO plans will have $0 copays for children under age 19, and you'll be able to identify them by the suffix of the plan name saying focus. So that's how you know those plans have the $0 copay for the kids under age 19 for new and existing PPO plans. We're making all primary care physician office visits for kids under age 19 have a $0 copay for all primary care physician virtual visits for adults and kids for our Health Sync plan. So all of our Health Sync HMO plans, all of them will have a $0 copay for children under age 19. So that's also an interesting addition as well to the portfolio. So this one here is for certain PPO plans identified as focus. The PPO network plans are Blue Access. The last column here, or last line here, are for primary care physician office visits for our HMO plan in the Health Sync network. So the HMO, all the HMO plans will have $0 copay for kids under age 19. This discusses the rates filed for 2023 for our small group ACA plans. 7.2% increase for 2023 plans. All savers you see there, which is level funded, but it's 14.7% of an increase just as a comparison. And the United down there at the bottom is 9.3% increase. So we were already point of advantage with United in 2022. This shows here it should be more of an advantage, or at least maintaining an advantage for 2023. So good news there. So the ACA should remain competitive. And let's see here. Anthem will have a 52% small group market share in the ACA market, and United will have a 32% market share based on projected 2023 membership. So we expect that this ACA rate filing that we just had, this filing will help us to gain even more market share in the ACA market. And what's interesting here is gold plans make up approximately 48% of our small group ACA membership. So, you know, we hear, of course, and we know that their health insurance is expensive, and we hear that, you know, the business owners, and we hear everyone talking about how expensive healthcare is, and it is. But it's interesting to also note that the gold plans, not the silver plans, make up our top category of plans that we sell to small groups in Indiana versus the silver. It's always interested us into how that could be. And bronze plans are they're hard to sell. They sell, but there aren't that many bronze plans that are sold. It's mainly gold and then silver. So this talks about our Blue Access and HealthSync network in the ACA portfolio. And you'll see here in the center there a purple indicator, and it's our 5 new POS plans. So we have 29 PPO plans on the Blue Access network, the old tried and true Blue Access network for Anthem Blue Cross Blue Shield. Has been around for a long time, well established, great discounts for the providers that you have on the Blue Access network. You have the 11 HMO plans, and then you have the 5 point of sale POS plans in the middle. That's a new wrinkle for us here in Indiana. That's a new plan design that we're really excited about. I'll get into it more later. RX Choice Network, which is the same with the RX90, so you can get your 90-day supply in the retail network and the retail pharmacies as well. So no change there. Then we have this engagement 200 plus EAP basic, which all the ACA plans are going to have. So the wellness package will be the same that we've had in 2022. So, introducing our new HealthSync 3-tier POS plan. So this plan we're excited about because this plan will be a hybrid, if you will, of the PPO network and the HMO network. In Indiana, it's hard to get people excited about an HMO network, but we see that being a trend going forward, that HMO networks will have more and more importance as time goes on. So to have people jump from being so used and comfortable with a PPO network directly to an HMO network when they have had Anthem, it has been difficult. But the 3-tier POS plan will have the most advantageous benefits if you choose the HealthSync HMO network. You see here in this example of a plan design, if you choose the HealthSync network provider, the deductible for that benefit will be $1,500. If you don't have a healthcare HMO network provider, but you have someone who's in the Blue Access network, fine, keep that same plan. That tier benefit will be $4,500 for your deductible. And yet you still also have out-of-network benefits here as well, which are much higher, of course. But this plan design structure like this, using this 3-tier POS plan, because it integrates the HealthSync HMO network, when you price it out and you compare it to a PPO plan, to our regular Anthem Blue Cross Blue Shield Blue Access PPO plan, it's going to be 7% less. 7% less premium to go with this HealthSync 3-tier POS plan with these benefits as you see here. The out-of-pocket maximum is the same whether you're in HealthSync with HealthSync providers or Blue Access providers, or you split the two. The out-of-pocket maximum for this plan, for example, is $6,500, no matter which one you choose. You can see as you go down the line here, there are richer benefits in the HealthSync network plan design. So if you stay in the HealthSync HMO network, you'll have a richer experience, richer benefits rather, than you will over here with the Blue Access PPO side. And once again, overall, 7% less to choose this plan. Now you've got to have clients who are able to be quoted in the HealthSync HMO network. I'll go over that in a little bit as well. So when you go on the provider site to find who the providers are in the network, there'll be an indicator to let you know if they're a tier 1 provider or a tier 2 provider. So that way you'll know how the claims are going to be paid on the as the HMO, HealthSync, on the richer benefits, or the PPO, which is still good benefits, just on the is more of a PPO level, which is a little bit higher or higher deductible, higher copays and whatnot. There's no smart shopper with these plans, same as the regular HMO plans, but you can offer these plans as a dual option with other HMO HealthSync plans. So let's say, for example, you want to have this 3-tier POS plan and combine it with an HMO plan. If you have 10 or more people enrolling, same guidelines as always, and at least 2 people will be on either of the 2 plans. You can pair it with an HMO plan. So here's a map of the HealthSync providers that we have in Indiana. On the Ohio border, it's kind of light down there in the Cincy area, which is mainly my territory, by the way, as well. But because you may have clients all over the state, anywhere in the state of Indiana, you can still quote it, or you can still try to quote it and see if you'll be able to actually have an opportunity to offer this to your clients. Ascension, St. Vincent, and Franciscan Health are the main major providers in this network. Of course, up here in this Fort Wayne area, you have Lutheran Hospital as well. But Ascension, St. Vincent, and Franciscan are the larger of the 2 hospitals that are in that HealthSync HMO network. So if you're not in that network, if not in the blue areas here, and you try to quote it, if your company's not, if the company's zip code is not in the blue areas, in the blue counties, you won't be able to quote the HMO nor that 3-tier POS plan. And these plans, these POS 3-tier plans, are in ACA plans, are MIWA, and also the Anthem Balanced Funding level funded plan also. We have these POS plans, these 3-tier plans, and all of those product offerings. But you have to be in one of the blue counties here in order to be able to quote it. I mentioned earlier, you can go online to see if the provider is a tier 1 or tier 2 provider, meaning tier 1 being an HMO HealthSync provider, tier 2 being a PPO Blue Access provider. So you go online and you sort by, on the right hand, the red square in the middle there, or red rectangle in the middle there, kind of. You click on that link and it will bring up what kind of provider this is, what network the provider's in. Tier 1 means they're in the HMO network. That means you get the HMO level benefits. If you check on it again, and you have a provider that's not in the HMO, but they're in a PPO network, you'll see tier 2. And that's how you'll be able to identify, or the clients will, what kind of benefits they'll have with that provider. They can search for them that way. Okay, on the legacy plans, we have a base rate increase of 4% on those legacy plans. We would not have the 3-tier plans on these. These plans, of course, are legacy. They're grandmother. They're not changing. They're the same, unless they have to change because the government changes in its regulations. These plans are already stable. So 4% is the rate increase. We have filed for 2023, which is very reasonable. But the groups can also see a change in their rates because of aging and risk factor changes because of their claims experience, for example, of course. We are targeting to move a select list of legacy groups to ACA that would receive a premium reduction to do so, as we've always done that, though. MEWA, the base rate increase is 5%. So that trend is going to be 5%, a little bit higher than the legacy, which is still reasonable. Let's see here. We're still targeting to move a select list of ACA groups to the MEWA that would benefit from them financially doing so as well, which is always the case also. Don't forget with the MEWA, if you have groups that are looking to come onto this MEWA from May through September, they have extended contracts. So of course, we're now going into peak season. It's not, we're not in this period now, but just write it down or keep it in your back pocket somewhere that groups that are written from May 1 through 9/1, they will renew 10/1 that current year, but the rates won't change until 10/1 the following year. So you can have, if you write a group in May, a 17-month contract for that client. With that rate not changing. If you write it in June, 16-month contract, and all the way up through September, which will give you a 13-month contract. So keep that in mind for that MEWA. The MEWA is unique in that way that we can have that longer contract for those plans. MEWA is hot in all the parts of Indiana. It's doing well primarily in Marion County, but Marion County is the largest county in Indiana, so that makes sense. So, but the MEWA is doing well throughout the state. It's doing well throughout all the different industries as well. So once again, this is our main preferred risk plan. The MEWA is the main preferred risk plan. Let's see here. Here's an example of the POS plans that we have with the MEWA. So the MEWA is going to have 6 of those 3-tier POS plans, where it's like a hybrid between the HealthSync HMO and the Blue Access PPO plans. We're going to have 6 of them there. 14 PPO plans, 6 HMO plan offerings, same RX network, same wellness benefits as well over here with the Engagement 200 with EAP Basic. This is the part where the Indiana Chamber, who was coming to our broker roadshow meetings also, they were also in attendance. This is where they got up and talked about the Indiana Chamber. I want to remind you also that there is, with the Chamber, you'll have the fees to join the Chamber, of course, but you also have a $5 per employee per month charge that's annualized, and you'll be, and the group will be sent the bill for that after implementation. So you'll have the regular fees based on the group size if it's in the Indiana Chamber, and Indy Chamber is a little bit different. But you'll have that, and in addition to that, you'll have the $5 per employee per month, per enrolled employee per month. That will be annualized. It will come a few days after the invoice date, the first invoice date. I think actually even as they renew, it's after that they renew will be right for that also. So any question about the Indiana Chamber, you can reach out to them. These are your contacts here at the Indiana Chamber. And so if you need more information from them or from me about them, just reach out to me, reach out to whoever you have as your contact there at Cornerstone, and they'll reach out to me or to the Chamber directly and get that assistance for you that you need. The Anthem Balanced Funding level funded plan here is an opportunity to get a 50% refund on excess premiums for the groups, but it also has reporting. So a small group in Indiana, we don't give out any reporting at all for small groups, but on this ABF plan, we will have reporting for the groups that are going to join this plan. The refund that we will give to the groups will be in the form of a credit. It won't be a check sent to them, it'll be a credit. And so the standard group size will go down to 10 lives. So 10 to 50 lives on the Anthem Balanced Funding level funded plan. That's our range of sizes there. $20,000 spec or specific stop loss, 110% aggregate stop loss, 50/50 surplus refund. And so this gives us the opportunity to be flexible with how we market to the small group market, if you will. but the first thing you're going to quote is the MEWA. So let's say you have a client who you think is going to be a good fit for the ABF, the level funded plan. Well, the first thing you're going to do is quote the MEWA, because the MEWA the ABF is built on the MEWA's chassis, if you will, as far as plan designs are concerned. And let's say, for example, we're still coming in with the MEWA quote, still not competitive enough with what's also being offered to them from a different carrier. We can then go into negotiation about the ABF and to see if the ABF can come in lower and be more competitive than what the MEWA could do. That's how that's going to work with our level funded option that we have here at Anthem Indiana. We have 11 PPO plan offerings with the ABF, 4 HMO, and 5 3-tier POS plan options. Same pharmacy network, same wellness package as well, but the 3-tier POS options will be available for the level funded also. So MEWA is the first, then you go into ABF. If you want the MEWA quote, you can just request it and say, I want to see that MEWA quote. If you don't want it, you say, I don't want to see it. I just want to hear what the rates are. And then, because I'm thinking we want to go to the ABF here regardless, you can do that also. But that's the first thing. So however you quote the MEWA, that's the process you'll take for the ABF. And then we'll go into more detail. So you got to have, for the ABF, you'll need to have competitive data, their renewal, the loss experience, claims experience rather. It can't be a virgin group. They must have existing coverage. So they must have a current group coverage in order to quote the ABF. So a lot more to go into with the ABF when you get to that point, but we now have that plan available to use in the situations where it needs to be used. It's now there for us. With PEOs, we have the IET, which is the Indiana Employers Trust, which is now available for all brokers to use, but it's only for certain SIC codes, builders, contractors, architects. There's certain SIC codes you have to use for the Indiana Employers Trust. HCC over on the right there is another PEO, Human Capital Concepts. They are also a PEO that we use at Anthem. I mentioned ADP earlier is also in the market for PEO services in the Indiana market. And then IPEP is Indiana Indiana Public Employees Plan. So for your municipalities, your libraries, schools, the water companies or town of, city of, those kinds of employers and organizations. There's a specific plan for them in Indiana that's underwritten as well. And some groups just like being in a plan like that. And so those plans are available for to be quoted. And you would reach out to me about that, and we would then move you forward to some contact either within Anthem to get to the IPEP or to the IPEP directly. However it's going to work, you're going to get back to IPEP regardless, and you get to those people who can help you over there. But they'll quote the group for you. They're not always the lowest price at IPEP, the lowest premium. But as I said, some companies just like being in with other municipalities, public employees, and offer those kinds of plan designs for their employees like that. And so that is there for you as well. So lots of offerings for you. That's the totality of the presentation I have for you for individual and small group for Anthem Indiana. We went to the large group update after that, and I have no idea what's going on with large group besides their large groups. So thank you for listening, for being engaged. And if you have any questions, you can get with me now or later or whatever. I'm here for you always. So Thank you.
Hi, I'm just trying to see if anyone has any questions that they have regarding this update.
Yes, it does look like we have one question. Arnie, you mentioned 2 new PEOs, HCC and ADP. Are those available for all brokers to write into, or are they exclusive arrangements where ADP is the actual broker? Is the HCC for larger groups? And same question, can any broker write into this plan?
Yeah, HCC is for anybody to write. ADP is also for anyone to write. I think it goes to a specific agency. You know, I've not had any engagement with them at all, but I believe there's a certain agency you have to go through in order to write it, but any broker can write it, yes. It's a different arrangement, different setup with ADP than it is through Anthem directly. But HCC is for any broker for sure, any broker at all. And the size is from 2 to 50.
All right, it looks like that's the only question we have.
If you want to know more about the ADP or HCC, our contact is Jody Yoder. So reach out to me, send me an email, and I'll forward the email over to Jody Yoder, and she can get back with you about more details on any of the PEOs or associations. That's her specific function within Anthem Indiana.
Thank you, everyone, for joining us for Anthem Indiana's fourth quarter update. Thank you. Have a great day.
You too. Thank you.
Thank you.